Hello and welcome to the Real Talk podcast. Today we have a community member, Claire. Claire began her transition to female at 45 years old. At age 50, she had her bottom gender-confirming surgery. It's been a year past her surgery, and let's talk about it. Well, welcome, Claire. We're so excited to have you today.
So happy to be here. Thank you.
Oh, of course. So to kick things off, could you share a little bit about your transition and your journey leading up to your gender-confirming surgery?
Well, I was 44 years old when I finally realized that I was trans. I had always known my whole life, but this is when I had finally accepted and gotten through my internalized transmisogyny and just fear of coming out and realized that I just couldn't, spend the rest of my life living a lie. So about almost a year after that, I was starting on hormone replacement therapy, which is taking a testosterone blocker and estrogen to simulate going through puberty.
Wow.
So that process took, I'm kind of still going through that process, but yeah, it's literally going through puberty again. So once that's on the road, and this, again, your mileage may vary depending on the type of transition you want to do. I wanted to go through the whole shebang. And so by that I meant not just hormone treatment, but also the quote unquote the surgery, or what we call GCS, gender confirming surgery. So to get that, one requires a sign off from two different surgical individuals. So I had my main therapist, who was my first surgical sign off, and then they referred me to another person. And then it's kind of in the hands of TransCare BC. So when I first started this process, there was literally one clinic in all of Canada where GCS could be done, and that was in Montreal. So up until then, and up until about 2019, I believe, that was the only place in all of Canada where these surgeries could happen. So soon after that, BC started doing them here. So now I qualified to get the surgery done here. The wait list was a little bit longer, but it required less travel. And so I put myself in line for that, to travel to and from Montreal is kind of costly, and it could have been covered, but it's just like a bunch of red tape that you don't want to have to go through and then be turned down for or anything like that. So I put myself on the list, and then it was radio silence for probably 2 years before finally getting a call from, again, TransCare BC saying, okay, we are getting you in touch with your surgeon. Now, again, I still don't have a date for this, but I have talked to the surgeon, and I have talked to the wound care nurse, and I've talked to a urologist, and you go through all of these processes of being interviewed, and they want to ensure that you have something that's called informed consent, which means that you know what you're about to go through, and they've told you all of the potential side effects, all of the potential problems that may arise from it, really what you're going through, because it is very, very body altering and cannot be reversed once it's done. So they want to make sure that, you are really aware of what's happening and the consequences of said actions. So I've gone through all of that process, and then there I am waiting for the call. That call being, we have a surgical date for you. And gosh, it was probably 8 months. I think about 8 months from the time I was getting my interviews with my surgeon to they called me up and say, we have a date for you. It's in 2 months.
Shock.
Absolutely. And now suddenly I've got to race to get everything in order because there's a laundry list of things that you need to prepare. Some of it is things you need to buy for the surgery itself or pre-surgery. Things like a donut so that you can sit down because obviously you're getting surgery down below. You cannot just sit willy-nilly anywhere you want. Like we need to make sure that things are comfy and padded and yeah. And then there's like special soaps you need to buy. And of course, any surgery that's done in the lower abdominal region requires bowel prep and just a ton of things. So all told, that was about, for just dollar value invested in that, at least $300 worth of stuff to make sure. You got to have tons of towels and there's all kinds of things you just don't even think of that would be required. Like now suddenly here I've gone through life with never having menstruated and I had to buy pads. Right? Yeah. Now, funny story, I didn't really end up using them other than I froze a whole bunch and used them as kind of like pain relief or swelling relief. But yeah, it was a whole thing I've never had to deal with other than, having a partner who menstruates and is like, can you get me this thing that, this product here, blah, blah, blah. Of course, I'm willing to do that. But God, I don't know. I don't know what I'm doing. So yeah, then, leading up to surgery, it was all quite just kind of like a steamroll. It was just like a snowball going downhill. Just things are happening. And then suddenly, boom, here I am in Vancouver. I'm at the hospital. It's 6:00 in the morning, day of surgery. And I've got, 3 bags packed and ready to go because they wanted me to stay down on the coast for another 2 weeks after the surgery. So it was close by in case there were complications. So I was staying in Langley, but yeah, yada, yada. There was a whole bunch of kind of baggage in the hospital that they didn't want me to have. But I'm like, where else am I supposed to put it? Until I get out of here, I'm not staying anywhere. And I don't have a hotel room. I don't have a house on the coast. So yeah, then they put you in they get you to strip down and they put you in this space blanket that's attached to the wall with a big hose and it's pumping hot air in at you. So comfy and warm because it's just super cold out there. And then yeah, into the surgery suite and they're like, here's, I'm your surgeon, I'm your anesthesiologist, I'm your other surgeon. These are the 2 nurses that will be assisting and you're asleep.
Just like that.
Just like that. And I believe it was 6.5 hours later, I come to in recovery room, all woozy, and they're like, yeah, everything's done. Looks great. And you're in hospital for a week while things kind of settle down and they're able, because, yeah, you have a catheter in. There's all kinds of, things that they have to make sure are going well before they can even release you from hospital. They took very good care of me. The nurses that were there were fabulous. I did have insurance from my job at the time, so I was able to get a semi-private room, which if you can do that, please do that for yourself because you don't want to have a room with 3 other people. It was bad enough having one other person in the room because, again, you don't know what their problems are, but you're trying to rest and get your relaxation and there's this person in the bed next to you crying in pain or weeping all night or yeah, it's just, if you can get a private room, get a private room. Just do it. Best advice ever. And then I've never had so many people interested in how much I'm urinating in my life. Yeah, it was crazy. So yeah. Then we get out of hospital. We go to my friends who I was recovering at down in Langley. They had a lovely little room with an ensuite bathroom set up for me. And yeah, for the next 2 weeks, I pretty much lived up there on my laptop. And that was how I was in touch with the rest of the world. But it was very isolated. And of course it's winter at the time. So and during a very heavy snowfall year, it was crazy trying to get around in Langley and down on the coast. It was very snowy. So I felt very isolated for sure, and far from friends and family. Well, I had a small group of friends there, but yeah. Then I came back to the Okanagan on a bus. I could not find a cheap flight. My ride had fallen through. So I took a bus that was just packed like sardines. And I had spent the last 3 weeks isolated. Get on the bus, get home, and I'm deathly ill. So ill, like dying of illness.
Well, you have a new body part.
Well, I have a new body part. And of course, nothing goes to plan for sure. So I had a few complications with some sutures separating, a little bit of, how did my surgeon put it? A little strawberry lemonade. But that's fine. It's not unusual, but you need to take a load off. So I spent even yet still more time lying in bed, which put my recovery back a little bit more. So it was very challenging, that part, like 3 months off of work for the whole surgery/recovery. I got back to work. I was still not recovered. Like I'd say I was about 70 to 80% recovered, but it's still like, you've just gone through a massive change in your anatomy and things are mixed up. It was challenging to get back. And I'm still, even now, 18 months later, still not to my activity levels pre-surgery. So it's been a long road.
So like you just said, it's been 18 months since your surgery and you're still not 100% to your normal activity levels. So what has recovery been like during that extra time?
That's a really good question. It's so life-changing because you don't know, like intellectually, what you're going through. Like you're changing genitalia from masc presenting to femme presenting. And so you would think logically, okay, well, I can't stand up to urinate anymore, for one. Well, I wasn't doing that anyway prior. Like pretty much once I came out of the closet, I'm like, I'm going to sit to pee. But it's still a whole different thing. Like, and they don't really, while they do try to prep you, there's a couple booklets that they give you. They're like, okay, here's kind of the expectation of what you're going to go through and some kind of benchmarks and whatnot. It's still the reality of now having vulva and labia and all of these other bits that you did not have before, and having to dilate daily. Like there's just all of these different things that you take for granted that they don't even cross your mind. Like now this is my reality that every day we have to dilate so that things don't close up. We've got to learn how to wipe. Nobody told me I would have to learn how to wipe. Like did you? It just seems like a no-brainer, but like yeah, like that part was different. And cleaning and even just exploration is how I would put it. It was very funny. So a few months have passed and things have kind of settled down. I'm no longer having like the nerves have pretty much detached themselves. There's a little bit of phantom pain here and there, but I had kind of not been super like exploratory, we'll say. And so I was finally having my surgeon got in touch with me to do a follow-up. And I talked about these concerns, and I never thought in my life I would have a surgeon or a doctor tell me you need to masturbate more. Right? Like, okay. Thank you.
Sounds good. Thanks.
Sounds good. Thanks. And coming to terms with like toys, for example, like just what a large part of sexual health that is for women. like, especially if you happen to be a woman that's not attracted to males like myself. So, yeah, it's such a huge part of your sexual health and necessary for kind of learning your new self. Like, that was a big part of moving forward and kind of accepting who I was. Yeah, and that was interesting for sure. But yeah, it took about, I would say almost till about 2 months ago for things to really settle down and just to be, okay, this is my new normal now. I'm not, this isn't a sensation that shouldn't be happening. Because again, it's like, how do I know what I'm supposed to be feeling when I've never had this body before?
I think also because there's not a huge percent of the population that has been through the same thing, that it's probably hard for you to find people to talk to about this kind of stuff too.
Right. I mean, especially in our local communities, it's not like there's a ton of us. It's not like we have like group meetings or, the coffee clutch where we all get together and compare our surgeries. Like, it's not really done. And like, with such a diverse range of people getting the surgery done from, you know, early 20s to 60s, sometimes 70s even, like there are going to be different challenges for all of those age groups. People heal at different rates as you get older. It's a lot harder to come back from surgery. The effects are much lessened, I would say, especially for things like hormone treatment and whatnot. It's much more, it takes a greater effect when you're younger. I feel it seems to be, just anecdotally, of course. But yeah, it's just been the last few months where things have finally started to level out, and I can start to feel like, okay, no, this is the new me.
And you were 50 when you had the surgery,
I
right?
was, yeah. I turned 51 this year, so it was in February of last year when I had the surgery.
So, like you said, it's interesting with the different walks of life for sure. Yeah. And a few years before that, you actually were diagnosed with CPOD.
COPD.
Oh, COPD. Thank you. And I'm sure like that was other like complications leading into it. So, yeah, it's probably very different for a young, quote unquote, healthy person.
Absolutely.
Yeah.
Yeah.
Then, I mean, you had to get clearances to be able to be allowed to have it because of your conditions and stuff, right?
Yeah. Well, I don't know that I needed clearances per se, but there's challenges with any person getting surgery. First of all, they're looking at your body mass, so perhaps if I'd been a little larger, they may not have even done it. Just because it's hard, I think it's hard for anesthetic, them to calculate how much anesthetic to give for larger people. But I mean, there is kind of an inherent, fat phobia kind of when it comes to
Absolutely.
healthcare. But, that being said, I was treated very well.
Could you describe the most significant mental and physical challenges you've had since your surgery?
Well, I would say mentally, it's just really coming to terms with the new anatomy. That's been my biggest challenge, is that I don't have those extra bits anymore. So coming to terms with now having a body that conforms with my inner vision of how it should be was, it's very affirming, but also, like I said before, it's very hard without knowing how it's supposed to go, where things should be at. So I would say that, yeah, the biggest challenge there was just not having a real guidepost or someone to hold my hand and go, now you're going to expect this. I mean, there's a slight amount of that, obviously, but everybody's journey is different. So finding where my journey lay in that was my biggest challenge for sure. So, and as far as physical changes are concerned, learning to pee again. And especially in the beginning, there was a lot of swelling down there. So, you pee and it starts going up your thighs. And like, Yeah, it's almost like you're a toddler learning to pee outside of a diaper. Like it's embarrassing. You're cleaning up messes. Like, oh, it was very horrifying at the age of 50/51 to be having to wipe pee off the floor in the toilet because, that day I had some extra swelling. Mortifying.
How does it feel now when you look in the mirror or when you think about having, now you're a biological female? How do you feel when you think about that?
So, yeah, that almost. So once I had left hospital, I was still down on the coast. I'm staying at my friends. And like I said, they had this nice ensuite bathroom. I had to get up very early in the morning to go to the bathroom. And I pee. And then I stand up and there's the mirror. I'm looking right at the mirror. And before I've even pulled up my pants, I just look in the mirror and see a woman. And I nearly started to cry because of how affirming that was. Just finally, like, this journey is almost done. Like, other than getting over the surgery, you're there, girl. And like, it was just so rewarding. It was so, like, everything up to this point has been worth it. The pain you've gone through, the waiting, all the mental gymnastics you've done to get where you are. Worth it. Absolutely worth it, because there you are and you're a woman and you're beautiful. And like, okay, you're a little bit swollen and bruised, but it doesn't matter because that's you now. So ultimately affirming. Like, I cannot state how that was my biggest mental hurdle to accepting myself, was not having the right parts. So yeah, it was incredible.
Was it like shock value for a while? Was it like
A little bit, but like, just that alone was just like so boom. Like, of course you mentally, like, that's why you're doing this. But the reality of it was just so in my face and stark, and just like, no, this is beauty. This is what you did this for. So it felt ultimately rewarding that, yeah, here we are. We've done it. Yay, we've done it.
and like instant reward too?
Yeah,
Right?
exactly. Because I mean, this was barely a week after actually having surgery. Like, I'm bruised up and swollen, and like, it didn't look pretty, but it was, right? Like,
It was to you.
it absolutely was. Yeah, no, it was fabulous. So, I mean, it was almost instant gratification. And then as we've gone through the months since then and things have settled and gotten better, like, it's just every time you look in the mirror and you see that that's you, it's just like, oh God, yes. I can't even remember what it was like before to not have this.
You waited your whole life
Yeah,
for
actually,
this.
like, literally have. And I tell you, tucking was a nightmare, and to not have to do that anymore is just, oh God, yes.
Can you explain what gender dysphoria means to you?
Yes. So gender dysphoria is something that is not, it's not experienced by all trans people, but many trans people experience this. And this is the disconnect between your self image, like what your brain says you are, and what your body is. So when you look in the mirror and you see, for example, myself in my journey, I was male bodied, and I saw that person and was repulsed by that person, made me feel it was incongruous with what my brain thought I should be. And so the dysphoria is that disconnect and the feeling of, this is not, it's like being an alien in your own body. And sometimes it can be disgusted at your own body, or just sadness at not being the person that you think you are or feel you should be. And so, yeah, it's very, It doesn't manifest the same for everybody, but with myself, it was definitely that person I know is me, but it's not me. And it caused a lot of pain and suffering. And especially when it came to my genitalia, the person that I was, like, just to see that was so horrifying to me. It's like, if just imagine any body horror movie that you've ever seen where your body is shaped in a fashion that is horrible. That's what it is. Like, that's not me. And I hate that thing. So yeah, that's kind of how gender dysphoria feels.
Right. And you felt that way since you were really young.
Yeah, exactly. For as long as I can remember, I identified as female internally. I never vocalized it really. Like, maybe there was a couple times I kind of expressed, oh, I should have been a girl, or I wish I was a girl, or you wouldn't treat me like this if I was a girl. But I mean, there was just no way to properly address it, especially growing up in the 70s and 80s. There was just so much rampant homophobia, and we didn't know what transgender was because there was just no. I mean, sure, there were trans people out there, but nobody talked about them. Nobody. We barely talked about cross-dressers, and that was only to laugh at them.
Exactly. Yeah. So now, what does gender euphoria mean to you?
So gender euphoria is kind of exactly what I talked about earlier when, I stepped up from that toilet to see myself in the mirror and feel like, oh my God, what I'm looking at is a woman. So it's that. And for some people, euphoria it's when you feel your gender has been affirmed. So sometimes it's simply, and there's kind of this is kind of a cliche, but with trans femme people, dress go spinny is kind of one of the very first kind of gender euphoria moments for many of us, where you've put on a dress, which even just dressing in the clothing you identify in your gender can be quite affirming, but then you take that spin and the dress goes out and down, and that is just like, oh my God, like, little girls grow up doing that and they kind of take it for granted, I think. But to be a grown ass person and to do that for the first time and feel that, it's just like, oh my God, this is so me, right? Like, so that's kind of the euphoria part of it. So to kind of tie the two together, the trans experience as a whole doesn't necessarily have either of those present. You can be transgender and never feel dysphoria. But I think the gender euphoria is kind of more ubiquitous amongst trans people, where to have your gender affirmed is way more present and prevalent amongst the trans experience. You may not have the dysphoria, but you're going to know when your gender is affirmed and it's going to feel good.
So what strategies have you found most effective for coping with dysphoria and euphoria?
So when it comes to dysphoria, I feel that initially what really helped was, number one, having your pronouns affirmed. So when you're out in public and someone calls you miss or ma'am or refers to you as the girls or ladies, like, that is just amazingly positive feeling. To have people call you by your chosen name. Things like that are just so important. To go and have a spa day, treat yourself, like, get your nails done, do a nice makeup look or something like that, put on a nice outfit, anything that, like, I mean, cisgender women go through that as well. How do you want to make yourself feel good? Well, you pamper yourself, or you put on a nice outfit, or, you do those things that just really affirm who you are. And being able to walk into a nail salon and not be treated any differently than any other person that's gone in there. And then to come out just feeling amazing, like that was really, really good for it. Now, when it comes to how do you deal with like the opposite of that? So when, say, I was misgendered or misgendering especially can be very, very hurtful. And then you kind of have to approach it from a standpoint of context. Because context, of course, means everything. So did that person, and I especially found this over the phone. I don't necessarily do a lot to change my voice. I speak a little bit higher, but I could be speaking up here. That would help in being identified more female, but I don't really push that. It's a bit hard on my voice to do that constantly. So when I'm on the phone, I get sir. So then it's simply a matter of going, actually, it's ma'am, it's miss. And most times people are like, oh, okay, sorry. And again, it's context. Do they really mean it? When they continue to do it, well, then, then there's some ignorance involved, and you can really, then it's how do you approach it? I try to be as positive as possible about it. I assert myself, obviously. But in person, I've found there are way less misgenderings, and yeah, it's very rarely that anyone's been openly terrible in that respect. So I've been very fortunate. Like over the 7 years of my transition, that first year was really the hardest when you're so self-conscious and every step you take, because you're living in dysphoria world at that time. It was very hard. Like sometimes you're scared to go out the door because you just like, oh God, like my eyebrows look terrible, and they may not even, but you see it. You see that one little flaw or whatever, and that's enough, especially when you're early on hormones. It's like going through puberty. You're just going to start bawling at the most mundane thing, and it feels like the world's against you, and you're like, I can't even face the world right now. I'm just going to crawl up and under a blanket and cry. But you get used to it. You start to, really understand where these feelings are coming from, and that when it comes down to it, you're the only one thinking about this, because the rest of the world's doing them, and they're very, everyone's kind of very self-focused, and they're not taking time to think about what you're doing, and unless you're really out there and in people's face. Like, they don't care. They don't care what you're doing or how you're presenting or what pronouns you're using. Like, and if you interact with them and you say, no, it's actually ma'am. Oh, sorry. So it's...
Move on with your life.
Yeah, you just move on with it. So, I think it just took a lot of time. It took time to get where I was, probably about 2 years before I was really comfortable in my skin and with who I was, to the point where none of that bothered me. Like, it would have taken a really, really in-your-face kind of person to upset me. And even then, that's their problem. It's not mine.
Many people wonder when a gender transition is actually considered complete. And how would you answer that question?
Again, it's dependent on the person. Some people, it's enough to just change their name and their gender presentation, and their anatomy is fine the way it is. They're done. For others, they need to go they need to have breast augmentation. They need to get tracheal shaving to remove some of their Adam's apple. There's another surgery you can get that shortens your vocal cords to raise your voice to be in a more feminine range. There is brow sculpting, cheek sculpting, chin sculpting, all kinds of facial things you can get done. Butt lifting, like any kind of, if you name it, gender affirming surgeries for cis women are overlap with trans women for sure. So, you can do all kinds of stuff along those lines. Of course, gender confirming surgery for the genital area. But some people don't want that. They just want hormones, whatever. So in my case, I would say I am complete my transition as far as any kind of invasive types of surgeries and whatnot. I don't particularly feel the need to be passing. And what I mean by that is the average person on the street walking by would never guess in a million years that I was assigned male at birth. But I'm not concerned with that. There, I am privileged to live where I do. I am privileged to have the family and friends that I do who did not forsake me when I came out. I don't have to fear walking down the street and being assaulted or anything like that. So I don't feel the need to go through all of the facial feminization surgeries and whatnot. I feel in my case, it's more important to be a visible member of the trans community so that I can raise awareness of who I am. I feel it's very important to have role models so that the children growing up today don't have to question without knowing that there are people like me or people like us. I had no role models. I had no one to look to. So if there had been maybe even one person growing up that knew my family or I could point to and go, oh yeah, Uncle so and so grew up like this, or Auntie so and so grew up like that. Then I could have possibly not led the life that I did and struggled as much as I did. So I think the more of us that are out there, it normalizes who we are. But that's my journey, and I'm comfortable with that. That's not to say that anyone else needs to stop at the point that I am. If you need to get, a butt lift and lip injections and boobs and all that other stuff, more power to you. And I support every step that you're going to take. Just like if you want to get tattoos, if you want to get, any kind of, you want to get plugs in your ears, like who am I to say that you shouldn't do that? It's your body. It's your life. And if you feel better because of that, heck yeah.
So going off that last question, does the transition ever end?
So yeah, again, it's like every person's journey is different. I do believe mine is, as far as what I'm going to go through medically. Now, I'm pretty comfortable in where I'm at as a woman. I'm very comfortable with my presentation, where I stand in my community, and all of those things. So I would say that for me, yes, it's done. But again, like there are people, cis people, who are addicted to plastic surgery and continue to get it. So that you're going to see that same analog within the trans community as well, where, I don't feel quite enough is done. And I think you'll find that that's far more common in places where being cis passing is important, because you're going to be looking at that mirror so closely and going, well, that forehead to chin ratio is too high, so, or my brows need to be lifted, or like there's just so many different things that we associate with femme features that, I mean, honestly, there are non-cis passing cis women out there who have, giant foreheads and wide chins and square jaws and things like that. So what does a cis person look like? You know, you show me the average cis person and I will show you a trans person that looks even more cis than that, and vice versa. So their journey may be more. Absolutely. Like, you know, there's just so many different levels to it. But I think that there is only so far you can go when it comes to the medical science. That being said, there has been some newer kind of like techniques going where I've even heard of uterus transplants,
Wow.
right? So who knows, within the next 20 years, we may have the first trans woman giving birth. Like, that would be crazy. And amazing, you know, like I think that's a part of my experience that causes me a bit of dysphoria, is that I couldn't have a baby. And maybe I'd want to. Maybe I'd like to go through that. You know, who's to say I can't have children, but I definitely can't have a baby, right? I can't birth a baby. So I think for some people really, really want that. And, you know, kudos to them if they can get that. But yeah, the journey for some will never end. For some of us, it never needs to begin. Or barely, you know, just like, yeah, call me that name and use these pronouns and I'm good.
If our listeners could take away one thing from today's interview, what should it be?
Oh my gosh, that's a good one. Well, I think that the thing I would hope to take away from this is that trans people aren't scary monsters. We're people just like you. We have hopes, we have dreams, we have, you know, an image of ourselves that it requires fulfillment just like anybody else. And that at the end of the day, we are just people too. And just because you don't understand us, understanding isn't required. You just need to accept. We accept cis people for everything that they are, usually without question. So, you know, the amount of scrutiny I think that trans people are under could be let back a little bit, and we could just you know, accept people are who they say they are, and to help them become that person instead of creating as much resistance as there has been. But all told, I think that it's a scary journey, but it's one that has been ultimately fulfilling, and at the end of the day is worth it.
Well, thank you, Claire, for coming out today. We really appreciate having you.
Thank you so much for having me. It's been a pleasure.
Yeah, of course. So thanks everyone for watching and listening today, and we can't wait to see you next episode. Bye.